Good afternoon, dear students. Yesterday you had, according to your schedule, last lecture from Propaedeutics of Internal Medicine, but unfortunately yesterday I did not have possibility to record it, but it is not a big problem because your practical class will be till the end of May, maybe even till June. That's why you have enough time till this topic on practical classes. You work with this lecture, with this recording. And I'm glad to say that yesterday I came to the Kharkiv after 2 months absence, and I'm very glad to be here at home. And what I want to say that our lovely city is living, is staying. Of course, the life here is a little bit different, but it is a lot of people here. It is even children in the street. Of course, it's present some danger here. That's why I'm not finally returned here. It is for several days, and after it I will go to my family, but I sure that the nearest future we all returns here, and I see my best of my students, all my students in our lovely university. That's why today it is your last lecture from Propaedeutics cycle. You will see me next study year on the 4th course with a new lecture, but for this year this lecture is the last, and the topic of our lecture is syndromes in diseases of blood system. I made it quite short with the main moments because in Propaedeutics you don't need any very deep and very detailed information, because it is a quite difficult field of internal medicine. That's why for Propaedeutics enough just to know the main terms, the main syndromes, diseases, and the main changes, the principles of diagnosing of different blood disorders. Okay. And first disorder that I'm going to discuss with you today, it is anemia. What is anemia? Let's give definition. It is decrease in the amount of red blood cells or hemoglobin in the blood, or lowered ability in the blood to carry oxygen. Causes of anemia. It is the main ways that lead to anemia. First, it is impaired red blood cells production, or hypoplastic anemia. Next way, it is increased red blood cells destruction. Here we include hemolytic anemias. It can be anemia due to blood loss or hemorrhagic anemia and fluid overload. And here in the scheme you see the main causes. It's just ways. It is a groups of disorders, and the most often causes is in scheme. It is excessive bleeding, it is menstrual bleeding, it is iron deficiency anemia, it is cancer causing anemia, genetic factors causing anemia, and impaired metabolism of spleen and anemia. It is not all, but it is the main causes of it. Let's talk more about impaired production or hypoplastic anemia. Disturbance of proliferation and differentiation of stem cells. It can be in pure red cells aplasia, in aplastic anemia, in anemia of renal failure, and anemia of endocrine disorders. This hypoplastic anemia can be due to disturbance of proliferation and maturation of erythroblasts, like in pernicious anemia, anemia of folic acid deficiency, megaloblastic anemia, anemia of prematurity, iron deficiency anemia, thalassemias, congenital dyserythropoietic anemias, etc. And it can be other mechanisms of impaired red blood cells production, like in myelophthisic anemia, myelodysplastic syndrome, and anemia of chronic inflammation. Increased red blood cells destruction. It is another way of pathogenesis of anemia, and this increased destruction can be intrinsic and extrinsic. Intrinsic or intracorpuscular abnormalities cause premature destruction, except paroxysmal nocturnal hemoglobinuria. They are hereditary genetic disorders. Eccentric or extracorpuscular abnormalities. It is antibody-mediated or due to mechanical trauma to red cells. And here you see a picture with example of anemias. Blood loss. Here a big number of different disorders can lead to blood loss and, like a result, anemia. It is anemia of prematurity. It is trauma or surgery causing acute blood loss. It is GI tract lesions like acute bleeding, peptic ulcers, chronic blood loss, or angiodysplasia. Gynecological disturbances like chronic blood loss, menstruation among young women or older women with fibroids, and infection by intestinal nematodes feeding on blood. Hydremia or fluid overload. Yes, and according to the name, we know the main mechanism of this anemia. It is fluid overload or hypervolemia with hemodilution, normal total amount of hemoglobin and red blood cells in the body. When the general number of red blood cells and number of hemoglobin is normal, but due to fluid overload, it make like a solution. Yes, so that's why in the volume it is decreased, it is relative number. It can be in excessive sodium or fluid intake, sodium or water retention, and fluid shift into the intravascular space. And it is typical for anemia of pregnancy, induced by blood volume expansion experienced in pregnancy. Diagnostic steps in anemia. It is clinical manifestations, hematological syndromes. First of all, we check blood tests abnormalities, blood biochemistry abnormalities, and bone marrow abnormalities. Signs and symptoms of anemia. They can be a little bit different in different types of anemia, but some of them are the same and specific for all anemias. It is weakness, fatigue, general malaise, poor concentration. It is dyspnea or exertion, or another name, shortness of breath. It is increasing cardiac output, palpitations, angina, if pre-existing heart disease is present, chronic failure, intermittent claudication, pallor. We usually see in such patients pale skin, lining mucosa, conjunctiva, and nail beds. Additional signs of severe anemia. In severe cases, it can be hyperdynamic circulation with tachycardia, bounding pulse, flow murmurs, cardiac ventricular hypertrophy. It can be signs of heart failure, pica, restless legs syndrome, especially in iron deficiency anemia. Diagnosis is based on complete blood count. First of all, the simplest test usually help us diagnosing anemia. Here we check blood smear, levels of hemoglobin, hematocrit, red blood cell size, reticulocyte count, reticulocyte production index. According to World Health Organization, thresholds used to define anemia. Yes, in children from half till 5 years, it is hemoglobin threshold in grams per deciliter. 11.1, and in millimoles per liter 6.8. In children's, the levels become higher. You see it in the scheme. Non-pregnant woman, adult woman, it is 12 in grams per deciliter and 7.4 in millimoles per liter. For pregnant women, a little bit lower, like for children, 11 and 6.8. And in adult men, it is 13 in grams per deciliter and 8.1 in millimoles per liter. Color index, it is one of characteristics of CBC, complete blood count. According to color index, result can be hypochromic when color index less than 0.85, like in chronic post-hemorrhagic anemia or iron deficiency anemia. It can be normochromic or normal from 0.85 till 0.05. It can be in acute post-hemorrhagic or hemolytic. And it can be hyperchromic more than 0.05. It's typical for B12 deficient anemia, for line deficient anemia, or aplastic anemia. Types of red blood cell size. It is one more sign that we check in CBC. The cells are small. If cells are small, we name it microcytic anemia. When size less than 80 fluorescence, typical, for example, for iron deficiency. When cells are large, we name it macrocytic anemia, with a size more than 100 fluorescence. Like in B12 or folate deficiency anemia. And when cells are normal, we name it normocytic anemia. It, for example, can be in anemic of chronic disease. According to regenerative ability of bone marrow, we check it by level of reticulocytes in percentiles, and we can divide all anemia on normal regenerative when it is from 6 to 12 percentiles, not percent, percentiles of reticulocyte. It is, for example, in anemia due to deficiency iron, B12, etc. It can be hyper-regenerative when percentile of reticulocyte more than 12, like in hemolytic acute post-hemorrhagic anemia. And it can be with decreased ability for regeneration and or hyporegenerative with level of reticulocyte less than 6 percentile. It's typical for aplastic anemia. Additionally to CBC, to complete blood count, we usually use a biochemical analysis of blood. What here should we check in a patient with suspected anemia? It is level of ferritin that is usually decreased in iron deficiency, serum iron the same decreased, transferrin saturation the same decreased in iron deficiency, level of folate in red blood cells, serum level of vitamin B12, serum methylmalonic acid and homocysteine, it changes typical for B12 deficiency too, renal and liver function tests, and erythropoietin level. Here we check for the main causes of the most main causes of anemias. Next syndrome for today, it is polycytamia. If anemia it was deficiency of red blood cells, polycytamia it is overproduction, a lot of some cells. Let's give a definition. What is it? Polycytamia is myeloproliferative condition that results in an increased level of circulating red blood cells in the bloodstream with increased in hematocrit, hemoglobin, or red blood cells count above the normal limits. Synonyms of polycythemia. In different literature, you can find this syndrome with names erythemia, Osler-Vaquez disease, polycythemia rubra vera, primary polycythemia, splenomegalich polycythemia, Vaquez-Osler disease, or polyglobulia. Risk factors of polycythemia. It is hypoxia from long-standing chronic lung disease and smoking. It is chronic carbon monoxide exposure. People living at high altitudes due to low environmental oxygen levels. People with genetic mutations and familial types of polycythemia and certain hemoglobin abnormalities. Causes. Primary causes. It is a slow-growing type of blood cancer. Yes, main diseases here. It is polycythemia vera, or primary familial and congenital polycythemia. But in some cases, polycythemia can be secondary due to something. What it can be? It can be secondary due to physiologically appropriate, for example, adaptation to living in high altitudes, or for example, iatrogenic, like in a response for some drugs or manipulations. It can be due to chronic hypoxia, like on COPD patients, chronic obstructive pulmonary disease, in hypoventilation syndrome, in chronic heart diseases, sleep apnea, pulmonary hypertension. Erythropoietin secreting tumor like hepatocellular carcinoma, renal cell carcinoma, adrenocarcinomas, uterine tumors. Relative polycythemia, the underlying cause is reduced blood plasma. Okay, let's discuss more detailed polycythemia vera. What signs and symptoms can be in such patients? It can be trouble breathing when lying down. It's typical dizziness, excess bleeding, full feeling in left upper abdomen with enlarged spleen, headache, itchiness, especially after the warm bath, red skin coloring, especially of the face, shortness of breath, phlebitis. Other symptoms that may occur with polycythemia vera. It is bluish skin color, fatigue, red skin spots, vision problems. Diagnosis. It includes bone marrow biopsy, complete blood count with differential, comprehensive metabolic panel, erythropoietin level, genetic test for specific gene, you see it here, mutation, oxygen saturation of blood, red blood cells mass, and vitamin B12. According to World Health Organization, we have criteria of diagnosis of polycythemia. Major criteria, it when the hemoglobin more than 18.5 grams per deciliter in male and more than 16.5 grams per deciliter in woman, or other evidence of increased blood cell volume. And second major criteria, it is a presence of this specific gene and other functionally similar mutation, such as another gene, exon 12 mutation. And minor criteria of polycythemia. It is bone marrow biopsy showing hypercellularity for age with a tri-lineage growth like panmyelosis with prominent erythroid, granulocytic, and megalokaryocytic proliferation. Another criteria is serum erythropoietin level below the reference range for normal and endogenous erythroid colony formation in vitro. Diagnosis of polycythemia vera study group criteria establish if all three category A criteria are present, or if one big plus two minor criteria, any criteria from category B are present. Category A criteria, it is total red blood cells mass more than 36 milliliters per kilogram in males and more than 32 milliliters per kilograms in females. oxygen saturation more than 92, and splenomegaly. Category B criteria. It is thrombocytosis with platelet count more than 400. Leukocytosis with a white blood cells count more than 12. Increased leukocyte alkaline phosphatase more than 100 units per liter, and serum vitamin B12 concentration more than 900 picograms per milliliter, or binding capacity more than 2200 picograms per milliliters. Next syndrome for today we named leukopenia. Let's give definition. What is that? Leukopenia or leukopenia, or another name, the same pronunciation, leukopenia in Latin, or leukocytopenia, is a decrement of white blood cells or leukocyte present in blood that places individuals at greater infection risks. Possible causes of leukopenia. It is viral infections like cold, flu, HIV or AIDS. It is microbial infections like sepsis, psittacosis, rickettsial infections, tuberculosis, malaria, dengue, etc. The causes of leukopenia can be autoimmune, like connective tissue disorders, for example, rheumatoid arthritis, systemic lupus erythematosus, etc. Cancer or other disease can damage bone marrow, like in leukemia, myelofibrosis, Hodgkin's lymphoma, and congenital disorders like Costman's syndrome and myelokathexis. Another cause, it is vitamin deficiency, like for example folate deficiency, a deficiency of minerals like zinc, copper, etc., and using of medications and radiation therapy, like due to using of diuretics, antibiotics, antipsychotics, and antidepressants. Signs and symptoms of leukopenia. It is anemia, thrombocytopenia, pneumonia, stomatitis, oral ulcer, and various infections. It is liver abscesses, metrorrhagia, menorrhagia, neurasthenia, fatigue and hot flashes, strong desire to consume hot drinks. Now one moment. Diagnosis of leukopenia can be identified with complete blood count. Here you see different result for white blood cells, for each size, its number, its percentage, what is the normal and what is atypical levels. Next disorder for today we name leukocytosis. Let's give definition to it. Leukocytosis, it is white blood cells or leukocyte count above the normal range, less than 50 in the blood. Okay, 5 principal types of leukocytosis and their causes. According to what type of leukocytes are affected, we can divide it in different types. First, it is neutrophilic leukocytosis due to neutrophilia. The main causes of it is bacterial infections, tissue necrosis. Another type, it is eosinophilic leukocytosis or eosinophilia. It is typical for allergic disorders, parasitic infections, malignancy, systemic autoimmune diseases, and possible in acute stress. Basophilic leukocytosis or basophilia. It is specific for myeloproliferative diseases. Monocytosis or monocytic leukocytosis, typical for chronic infections like tuberculosis, systemic autoimmune diseases, etc. And lymphocytosis or lymphocytic leukocytosis, It's typical for chronic infection too, but here on the first place goes viral infections, and it can be in tuberculosis, brucellosis, pertussis, and malignancy. Signs and symptoms of leukocytosis. First of all, it is the most often it is fever. It can be bleeding or bruising. It is feeling weak, tired, or sick. Feeling dizzy, faint, or sweaty. Pain or tingling in arms, legs, or abdomen. Trouble breathing, thinking, or seeing. Losing weight without trying or poor appetite. Diagnosis. Leukocytosis can be identified with a complete blood count. The same scheme with the previous. Here, by the changes, you can find the place of leukocytosis. What I say more about leukocytosis? Excessive numbers of white blood cells are most often due to a response of normal bone marrow to infection or inflammation. In some instances, leukocytosis is a sign of more serious primary bone marrow disease, like leukemia or myeloproliferative disorders. Leukemia. Let's stop on this name and this group of diseases. Definition. Leukemia, it is abnormal proliferation of the blood-forming tissues that usually begins in the bone marrow and results in high numbers of abnormal white blood cells. Causes of leukemia. It is mutations in the DNA as a result of exposure to radiation or cancerogenic substance, and the genetic predisposition. And here you see on the picture example of scheme of normal blood structure with a low number of young forms, and leukemia. You see much more bigger number of young forms of some blood cells. It can be leukocytes, erythrocytes, lymphocytes, different. Now, if we talk about leukemia, leukocyte first of all, they are functionally not normal. They are young. They are usually bigger, like on this scheme, and such picture in a light microscopy can say you about presence of leukemia. Classification. According to cell type, it can be lymphocytic and myelogenous. Please, this scheme, remember, it's very simple table, but who don't know, please rewrite to your conspect, note for yourself, and remember, it is the simplest thing classification of leukemia, and in general the key to understanding of a big group of blood disorders, and a lot of tests in CROC 2 will be about these schemes. That's why what is lymphoblastic, myeloblastic, acute and chronic, you should understand. That's why by the cell type it can be two main types leukemia, like lymphocytic leukemia or lymphoblastic leukemia, and myelogenous or myeloid leukemia. And according to type of progression, it can be acute and chronic. And in these two classifications, we can, from these two classifications, we can make four main forms of leukemia. It is acute lymphoblastic leukemia, chronic lymphocytic leukemia, acute lymphoblastic leukemia, and chronic myelogenous leukemia. Why we don't use cytic and blastic for acute and chronic? Because blastic it always mean that it is acute, because for acute form the main sign it is a huge number of blasts. That's why in acute forms we use blastic, and it's not completely correct for chronic forms, because in chronic forms not just blood, it is different intermediate forms can be in the blood of cells. That's why
more correct name for it, cytic. That's why for
forms we use lymphocytic or myelogenous. For acute forms, lymphoblastic and myeloblastic. Signs and symptoms of leukemia. It is a big number of different symptoms, but the main of them and most specific. It is fever or chills, persistent fatigue, weakness, frequent or severe infections, losing weight without trying, swollen lymph nodes, enlarged liver or spleen. It is easy bleeding or bruising, recurring nosebleeds, teeny red spots in skin like petechia, excessive sweating, especially at night, and bone pain or tenderness. Acute leukemia. It is characterized by a rapid increase in the number of immature blood cells. What I told about you, I named them blasts. Their crowding due to such cells make the bone marrow unable to produce healthy blood cells. Immediate treatment is required in acute leukemia due to the rapid progression and accumulation of malignant cells, which then spill over into the bloodstream and spread in other organs of the body. Chronic leukemia. It is characterized by excessive buildup of relatively mature but still abnormal white blood cells. What I told, for acute it is just the youngest form, the blast, but here for chronic forms it is relatively mature, like intermediate, but they are still abnormal. It's typically taking months or years to progress. That's why we name them chronic. The cells are produced at a much higher rate than normal, resulting in many abnormal white blood cells. Mostly occurs in older people, but can theoretically occur in any age group. Diagnosis of leukemia. They are based on repeated complete blood counts and blood films. We check for Philadelphia chromosome in genetic analysis. It is for confirming it. It is obligatory bone marrow examination, and here you see examples of microscopic examination of bone marrow. It is a lymph node biopsy, like what is important in lymphomas, and visualization methodics like X-ray, MRI, ultrasound. First of all, to finding of and checking of enlarged lymph nodes and enlarged lymphoid tissues and metastasis. Next syndrome for today, it is hemorrhagic syndrome. Definition: the extravasation of red blood cells from the vasculature into the skin and subcutaneous tissue in form of petechia, purpura, and ecchymosis. It is collectively referred to as a purpura, with purpuric rashes formation. The extravasation occurs internally, where the red blood cells leaks from the blood vessels inside the body. Purpura forms, we name it in the definition. Let's stop one more time. It can be petechia, purpura, and ecchymosis. It differs first of all in size and possibly in form. Petechia, it is pinpoint red lesions less than 2 mm in size. Purpura, it is pinpoint red lesions from 2 to 10 mm in size. And ecchymosis, it is pinpoint red lesions more than 10 mm in size. Principal types of hemorrhagic syndromes and their causes. First type, it is thrombocytopathy. About causes. Any of blood disorders characterized by dysfunctional platelets, thrombocytes, with either normal platelet counts, non-thrombocytopenic purpura, or decreased platelet counts, like thrombocytopenic purpura, which results in prolonged bleeding time, defective clot formation, and tendency to hemorrhage. like in Schönlein purpura, von Willebrand disease, thrombocytopenia, platelet aggregation, etc. Next big group of hemorrhages, it is hemophilia. It is a group of hereditary genetic disorders that impair the body's ability to control blood clotting, which is used to stop bleeding when a blood vessel is broken. Most often types, it is hemophilia A, clotting factor A deficiency, the most common form of the disorder. Hemophilia B, factor 9 deficiency, occurs around 1 in about 2,000-34,000 male births. It is genetic, it's typical for male patients. It is a lot of types, not a lot, but several types, many of them A and B. Another type of hemorrhage, it is telangiectasia. Small dilated blood vessels near the surface of the skin or mucous membranes measuring between half to 1 millimeter in diameter. Hemorrhagic syndrome. Signs and symptoms. Most typical signs and symptoms are purpura, sometimes mucosal bleeding, with different localization and distributions. Moreover, not just bleedings, not just purpura, it's typical arthritis and arthralgia due to, first of all, hemorrhagic. It is bleeding in the joint. It can be central nervous, GI, cardiovascular, or retinal system involvement with bleeding in these systems. It can be prolonged heavy menstrual period or menorrhagias in female patients. It can be unexplained nosebleeds, extended bleeding after minor cuts, blood draws or vaccinations, minor surgery or dental procedures. And it can be bleeding after aspirin use. According to World Health Organization, we can grade hemorrhagic syndrome into 4 grades. Grade 0, it is no bleeding. Grade 1, it is petechial bleeding. Grade 2, mild blood loss, clinically significant. Grade 3, gross blood loss, requires transfusion or severe bleeding. And grade 4, it is debilitating blood loss, retinal or cerebral, associated with fatality. For hemorrhagic, typical causes of hemorrhagic syndrome, most often it is grade 1 with petechial bleeding with present some petechias, but possible another more severe grades. Diagnosis of hemorrhagic syndrome. It based on platelet count on CBC. In platelet function, like bleeding time, platelet aggregation studies, von Willebrand factor studies, specialized tests. Moreover, we can do coagulation screen with clotting factor deficiencies. In the patients on warfarin, we obligatory check INR or international normalized ratio. And autoantibody screen for connective tissue disorders that can be associated with hemorrhages too. I promised you not a long lecture. The main points, the main definitions I give you. You have time to prepare to your practical classes about blood disorders, signs and symptoms. If you have questions, as usual, waiting to you on our Facebook page. It is closed not for students. That's why here you can write just for us and for you. And as usual, I ask students to leave your names and number of groups in the comments under the video on YouTube. I'm waiting for your questions, for your comments and proposition. And for today, goodbye. See you.